Hi, so welcome all to our next session of the Thorax MCQs. I'm Doctor Ankit and welcome to our YouTube channel Human Anatomy by Doctor Ankit. So we are into this week where we discuss the Thorax MCQs, and let's move to the second day. And here's the first MCQ for the day. The question asks that which of the following is correct regarding the relationships of the vagus nerve in their passes through the thorax. So vagus nerve passes through the thorax. Vagus nerve coming from the brain, 10th cranial nerve goes from the neck into the abdomen via thorax to supply the foregut midgut. In the thorax, it lies close to the esophagus because esophagus is also a part of the foregut. Right. So let us see which is correct and which are the wrong statements over here. Right vagus passes onto the anterior aspect of the esophagus to become the anterior vagus. Now, it's a very important point. See, what happens is that suppose this is the esophagus over here, okay, and here we have two vagus nerves, the right and left vagus nerve. One has to become an anterior vagal trunk, one has to become a posterior vagal trunk as we go into the stomach. Now, due to the rotation of the foregut, mainly the stomach, what actually happens is the right vagus nerve goes to become the posterior vagal trunk, and the left vagus nerve moves anterior to become the anterior vagal trunk. So the right vagus actually becomes the posterior, not the anterior. So option A wrong. Left vagus passes through the anterior mediastinum. We will see the parts of mediastinum. Anterior mediastinum is an area which is between the heart and the sternum, or between the pericardium and the sternum. Very few lymph nodes or the sternopericardial ligaments or remnants of thymus are only located over there, not the vagus. Vagus is passing along with the esophagus, which lies in the posterior mediastinum. So anterior mediastinum is wrong. Vagus passes posterior, right vagus passes posterior to the root of the lung. Now, esophagus is passing through the posterior mediastinum, which is actually behind the root of the lung, and as vagus passes along with the esophagus, so it will also pass posterior to the root. So this is the correct statement. Let us see last statement. Vagus passes through the middle, as is already said, through the posterior mediastinum. So answer is option number C. Let us review all of that. This is a sagittal section to show you the parts of mediastinum. Here, this blue colored over here, this is the superior mediastinum, and all this is the inferior mediastinum. In the inferior, you can see the yellow color is the anterior mediastinum, the red color is the middle, and the green color is the posterior mediastinum, and these are already labeled over here as well. Okay, this is the posterior one. Okay. Now, esophagus is where? This is the esophagus. You can see it is passing through the green color, that is the posterior mediastinum, and therefore the vagus nerves will also be passing along with this same esophagus. So they will be passing along with the esophagus. Okay, that's the whole point. Now, if you see another figure over here, this anterior view, here what are being shown to us is this the diaphragm over here, this is the pericardium, and behind you can see that here lies the esophagus that is coming down. And this is the vagus nerve, which is the vagus nerves you can see over here, which are that are coming along with the esophagus behind the heart. Okay. So that tells us that the vagus nerve passes along with the esophagus in the posterior mediastinum behind the root of the lung. The right vagus becomes the posterior vagal nerve or the posterior vagal trunk, and the left vagus becomes the anterior vagal trunk. Let's see the second MCQ. A 39-year-old male is admitted to the hospital with a complaint of severe retrosternal pain that radiates to the left shoulder. Severe pain over here that's going to the left shoulder. The pain is relieved by leaning forward. Auscultation reveals a pericardial friction rub, luckily. So it's a case of pericarditis, leading to a diagnosis of pericarditis. Which nerve is responsible for the radiating pain? Now they are saying, okay, they have made the diagnosis. They are not giving the details of the whole history, examination, investigation, but they said, okay, fine, it is a case of pericarditis. They are saying the pain is occurring, that is going from retrosternum to the left shoulder. They are asking you, can you identify which nerve is causing the pain? So either you know which nerve supplies the pericardium, then you can answer, and you should also point out that how is the referred pain going to the shoulder. So because heart is not located at the shoulder. Point over here is that the nerve which is supplying pericardium should have a referred pain going to the shoulder. Or shoulder dermatome is around by supraclavicular nerves around C3, C4, C5. And if you look at the nerves, then this root value is shared by the phrenic nerve. But does phrenic nerve supply pericardium? The answer is yes. Phrenic nerve does supply the fibrous pericardium and the parietal layer of the serous pericardium, the outer covers of pericardium. So it's a phrenic nerve, that would be the answer, and here is a phrenic nerve. Let me show you image over here. See, this is a sagittal view and a cadaveric view, the anterior part over here, the posterior part over here. This is the pericardium. I'm writing P dot cardium, that is pericardium, right? And this is the, you can imagine the aorta, the arch of aorta going back. This over here is the, you can say, the root of the lung. Now, I'm putting some white arrows over here, identify this structure. This is the phrenic nerve that is running over the pericardium. So, phrenic nerve is actually sandwiched between the pericardium and the pleura. The pleura has been removed. The left lung and the left pleura has been removed from this particular specimen. So, phrenic nerve actually is a thread-like nerve that is sandwiched between the pericardium and the mediastinal pleura, not the entire pleura. And phrenic nerve therefore gives sensory supply to both of the pericardium and the mediastinal pleura. Therefore, pericardium and the mediastinal pleura. And pericardium is supplied by phrenic nerve. Phrenic nerve root value is C345. So, it can also explain the referred vein going to the left shoulder. Answer is phrenic nerve. Coming to other options, see, intercostal brachial nerve is T2. Is T2, right? And that is basically injured or cut while doing any dissection or surgery on the axillary region. Long thoracic nerve is supplying the serratus anterior. Okay, C5, C6, C7 is the root value. It supplies the muscle serratus anterior. Remember, winging of scapula. Greater thoracic splanchnic nerve is actually a sympathetic nerve. Okay, it's a sympathetic nerve. The greater splanchnic, lesser and least splanchnic. These are sympathetic nerves, and their root values are from middle thoracic to the lower thoracic and the upper lumbar region. Right. So therefore, this is the question. Come to the next one. A 14-year-old boy is brought to the emergency because of acute left-sided chest pain and dyspnea following a motor vehicle accident. So it's a trauma in the trauma history. So left side chest pain and dyspnea. 14-year-old, just a young boy. His pulse is 122 and BP is 85/45. Examination shows distended neck veins and tracheal displacement to the right side. Very important examination finding, distended neck veins. So there is some obstruction in the venous flow. And trachea displaced to the right side. This dyspnea also. There is mediastinum shift, the trachea is going to the right side, plus you have a distended neck veins. The left chest is hyperresonant to percussion. Hyperresonant. More air is entering into the thoracic wall or the superficial part of the left chest. And there are decreased breath sounds. Very important finding. So, though so much of air is there in the left chest, but there are no breath sounds. So, air is being, this air is somehow coming into the left pleural cavity. So, it's a case of pneumothorax on the left side, and this air is pushing the trachea to the right side, or it is giving a mediastinal shift to the right side. Okay, just compressing the veins also leading to distended neck veins, and also dyspnea because left lung is being compressed. So basically, it's a case of what? It's a case of left-sided pneumothorax. This explains everything, and also it's a trauma history. The patient would most benefit from needle insertion at which of the following anatomical sites? Obviously, you have to take the air out because it's going into tension pneumothorax, going to dyspnea. Slowly, it will go to cyanosis. There is so much of air accumulating in the left pleural cavity. You have to take the air out. Air. So, do a needle insertion at the upper part of the pleural cavity. Air will gush out, and instant relief to the patient. Instant relief to the patient. Options are second left intercostal space along the midclavicular line. Very good option. We can go with this. Other option is fifth left intercostal space along the mid-axillary. See, air has to go up, so there's no point going to the mid-axillary in the fifth intercostal. That would be better for a chest tube placement. Eighth left intercostal space, that is too low. Subxiphoid plane in the nose, fifth left intercostal along the midclavicular nose. See, its second left is fine because air will come up and air will gush out, and then you can put a permanent, you can do a thoracostomy, you can put a permanent chest tube while going through the fifth space in the mid-axillary plane. So, answer therefore will be option number A, will be best. Let me show you an image over. See, what is this? This is actually the anterior view. Okay. So, slowly what actually happened is the air started to enter outside into the pleural cavity like this. As the air started to enter, it started to push the lung. As the lung pushed, the mediastinum also shifted. You can see in the question what was given, the trachea was shifted to the right side. Now, as there is so much of air which is entering over here, air entering over here into the pleural cavity, not inside the lung. Now, what you do is you put a Put a needle over here, the second space needle, and the air, all the air actually will gush out, giving relief to the left lung. Left lung will again dilate. Okay. So this was the question. Come to the next question. A medical resident is preparing to insert a central venous line into the left brachiocephalic vein. Where left brachiocephalic vein? Of a 10-year-old patient, which of the following is the correct relation of the left brachiocephalic vein? The whole question is about the anatomy of the left brachiocephalic vein. Long name. Brachio means upper limb, cephalic means head neck. So there is a vein coming from the upper limb, there is a vein coming from the head and neck. They both will join, they will form this brachio BCV, brachiocephalic vein. The vein coming from the upper limb is the subclavian vein. The vein coming from the head neck is the internal jugular vein. This is the brachiocephalic vein. This left brachiocephalic actually will join with the right brachiocephalic to form the superior vena cava. This will be the right side brachiocephalic. This is the left side brachiocephalic. Now, this is the area of interest of this particular resident. Do remember the left brachiocephalic vein also crosses the midline. Now, where would the resident try to find this vein? Will the vein lies posterior to the arch of aorta? Do you think so? Arch of aorta is more superficial? Answer is no. Arch of aorta is more deep to the vein. The brachiocephalic artery lies, see, artery will lie mostly deep to the vein. The vein crosses the anterior aspect of the manubrium of sternum. Sternum is a subcutaneous bone. You can feel it. Do you feel any vein in front of the manubrium sternum? Obviously not. Answer obviously is option number D over here. The vein passes deep to thymus gland if there is thymus gland present. Let me show you some images. You will understand from there. So remember the focus over here. The focus is on the left brachiocephalic vein. Now let us see some images. Again, the mediastinum, showing you the middle mediastinum over here, the posterior over here, the superior and the anterior over here. Right, that we already seen. This is a cadaveric dissection. Here let me point out, this is the left internal jugular vein. This is the left subclavian vein, and here this thick vein, if you can see, this is the left brachiocephalic vein. It is crossing the midline going from left to right. And if I show with some red arrows, this red arrow is pointing towards what? A brachiocephalic trunk. It's an artery, right? This is your left common carotid. So vein is lying superficial to these arteries, not this arch of aorta, even the brachiocephalic artery. Here, what has been removed is the sternum has been removed, and thymus remnants, if they were present, they have been removed. These things have been removed. So you can see vein is lying superficial to the arteries. Now, let me actually try to show you. If you make a transverse section over here through the superior mediastinum, so if you make a transverse section through the superior mediastinum, what structures will we see? Have a look at this. Very important image. That is anterior, that is posterior. Most anterior, obviously, you have the sternum and the attached muscles, which are going, strap muscles going to the neck. Behind the sternum, you have this thymus or remnants of thymus. Then you have this left brachiocephalic vein. That was the one that was asked in the question. This is the left brachiocephalic vein. So it is lying behind the thymus, as was in the last option. And here you can see all these are the branches of arch of aorta. Then you have the trachea, esophagus, vertebrae, and the few of the nerves lying on the sides. So look at the arrangement. Always do focus from anterior to posterior. From anterior to posterior, what are the structures lying in the superior mediastinum? It's first the sternum, then the thymus, then the vein. Then you have the arch of aorta or its branches, and then you have the trachea, the esophagus, the vagus nerve, the recurrent laryngeal, the phrenic nerves all around the trachea, esophagus. If you can just want to see, here you have what? These are both the vagus nerve, right? One vagus nerve over here, the other one will be over here. Only the left recurrent laryngeal nerve will be there, but you again have both the phrenic nerves, and you have the thoracic duct along with the esophagus. So remember this diagram. That was all, guys, for today's session. We'll meet again tomorrow with some other MCQs over here, right? So that's all. I hope you're enjoying. Thank you.